Hello everyone, today I will speak about colorectal cancer, which is cancer of the colon and the rectum. Before I actually goes deep into colorectal cancer, let me make a few comments about cancer in general. What is cancer? Cancer happens when any normal cell in the body grows out of control and kills normal cells surrounding it to the point of making a person sick. There are many kinds of cancer, but this video will only focus on colorectal cancer, which are initially defined as the cancer of the colon and rectum. Colorectal cancer starts at the colon or rectum initially and start by growing into polyps. Note that colorectal cancer can affect only the colon or the rectum or both of them together, depending on where the cancer growth starts. Initially, the cells develops polyps and start growing into abnormal cells and becomes, over time, cancerous. There are two types of polyps that grows into colorectal cancer. The first one is adenomas. It's called adenomas, which are polyps that are mostly precancerous because they often will turn into actual cancer. There is also hyperplastic polyps and inflammatory polyps. These are very common, some very common polyps, but fortunately, the hyperplastic polyps and inflammatory polyps usually are not precancerous. Let me talk about statistics. Colorectal cancer is the second leading cause of cancer in women and the third leading cause of cancer in men. But fortunately, the death rate has been falling down because of early detection and treatment of the cancer. The symptoms of colorectal cancer are diarrhea or constipation, changes in bowel movements, blood in stool that makes it look black, pain and bloating in the abdomen, the person feeling fatigued, weight loss unexplained by dieting, feeling of fullness in the abdomen even after not eating for a while, and unexplained iron deficiency. These are all symptoms of colorectal cancer. There is a screening that needs to be done to find out if a patient is having colorectal cancer. There are several methods that are done for this screening. There is the first one, which is fecal occult blood tests. This checks for blood in the stool that cannot be seen visually. There is also another test called stool DNA test. There is the sigmoidoscopy, which examines the rectum and sigmoid colon using an instrument with a flexible lighted tube and lets to view the colon. And then there is colonoscopy, which looks into the colon and rectum and examines it thoroughly and see if there is polyps that might be cancerous. The risk factors for colorectal cancer are old age, diet high in animal protein, saturated fats, and low calories, diet low in fiber, high consumption of alcohol, history of any kind of cancer. It could be the breast, ovarian, family history of colorectal cancer, history of Crohn's disease, irritable bowel syndrome, or ulcerative colitis. When a patient is overweight and obese, it is a risk factor for colorectal cancer. Smoking is a risk factor. Lack of physical exercise, and the presence of polyps in the colon or rectum. I have to say also, eating red or processed meat will also increase your risk of colorectal cancer. The prevention of colorectal cancer, regular screening for early detection of the polyps for everyone who is over 50 years old is recommended. People with history of cancer, Crohn's disease, needs to have regular screening every year. Another preventive method that can be done is eating diet with plenty of fiber, fruits and vegetables. Exercise regularly, and losing weight if you're obese or overweight. Treatment of colorectal cancer. The treatment depends on the size, location, and stage of the polyp cancer. There is chemotherapy, which uses medications or chemicals to destroy the cancer cells. Surgery is the most common treatment, where the surgeon will go in and get rid of the polyps. Radiation treatment, which kills the cancer cells. There is a method also called ablation. This method uses radio frequency to destroy the tumor cells without actually removing them. They will still be in the body, but it will destroy them. I hope this information will help you to take care of yourself and prevent the problem of colorectal cancer. Good luck.